Speaking of, this past cold and flu season was very hard on a lot of families, especially families with asthma. What should parents know about viral infections and keeping their kids safe?
Viral infections are probably one of the most common triggers of asthma exacerbations or asthma attacks. And so the things that we recommend are the same thing that, most pediatricians, primary care doctors would recommend. You want to obviously encourage good hygiene in terms of hand washing. If you know that your child tends to be provoked during viral infections, you may want to keep them out of very crowded areas um, or known exposure to somebody who's sick. You can ask loved ones to be kind of cognizant of the fact that your child has asthma and maybe they shouldn't come to visit. And you want to know their triggers. So if you know their triggers are also cold weather, you want to avoid necessarily doing things outside when they do have a little bit of a viral infection, on top of kind of bringing one more trigger. So I think for parents, knowing triggers, whether or not there's more than one trigger going on at the same time, and obviously trying to prevent the infection. The most important thing is really getting the flu vaccine in terms of the flu, which was hard this past season. So that's one thing that I do encourage, especially parents of children with asthma. It's a very important thing that can really keep them out of the hospital.
Okay. Why does it seem like so many children with asthma have recurring ear infections and sinus infections? Is there a relationship there?
So, I like to think of the ears, nose, and throat as kind of one continuous area, and doctors will call that the unified airway. And it's something that we talk about a lot in terms of upper respiratory and even lower respiratory problems. And so ear infections and sinus infections can be tied to underlying inflammatory disorders like allergies. And allergies we know have a large role in asthma, just like asthma is explained as a hyperreactivity of the lungs, allergies are oftentimes thought of as kind of a hyperreactivity of the nasal passageways and upper airway. And so perhaps there's an underlying inflammatory condition that's predisposing. And then the other thing is with younger children, school-age children, they oftentimes still have large adenoids, which can be a routine finding in a child. But that may also present with symptoms of recurrent nasal infections, fluid in the ear, or even recurrent ear infections. And those are all highly tied, again, to an underlying inflammatory problem, just like asthma.